So our next speakers are Dr. Andrea Spiri and Dr. Solene Meunier, who are coming up as a double act, which is great. It may interest you to know that Dr. Andrea Spiri was winner of the 2022 European Advisory Board for Cat Diseases Young Scientist Award. Very impressive. And they're going to be talking to us about FIP treatments and therapeutics. Thank you.
Thank you very much. Thank you very much also to the organizing committee for the invitation that we have the possibility to speak here today about our study. Okay, so first of all, I would just like to say that we too are just the representatives of quite a big group that we have at the University of Zurich doing this FIP treatment study. I don't go through all the persons now, but just we are the representatives, being very lucky to be in beautiful Cyprus for this wonderful symposium. To give you a little bit of background what happened on the European side of FIP treatment, I would like to mention the first European treatment study that has been published from the coronavirus in cats and kids group. And as a side note, maybe you wonder why I mention also kids in this slide. So in kids, there is a syndrome called pediatric inflammatory multisystem syndrome, and it's a disease of kids when they had previously SARS-CoV-2 infection. They can suffer from this very severe inflammatory disease. And FIP and PIMS, they share quite a lot of similarity, so it's very nice that in this study group we also have pediatricians on site. This study has been published by the group of Katrin Hartmann in collaboration with the clinical laboratory in Zurich. They had 18 cats with FIP and they treated them with XREF-CON. So this is a product that contained mostly GS from a Chinese manufacturer, Mutual Life Science. It was not a controlled or any kind of licensed drug. With 5 or 10 milligram per kilogram for 84 days, according to the manufacturer, was the dosage. They had a very good success rate. All of the cats, they survived the FIP. They were all healthy 1 year after treatment for those where the follow-up was available. Most of them, however, showed persistent lymphadenoma, and 2 of these cats showed a feline hyperesthesia syndrome later on after stop of the treatment. There was no reoccurrence or relapse of FIP in these cats. What was also studied in these cats were the fecal shedding. Most of the cats were shedding feline coronavirus in their feces in the beginning of the treatment, but by day 6, they were all negative. However, 1 cat started reshedding at day 83, so at the end of treatment, and 2 cats, they started shedding during the treatment. They were negative before and then started shedding. So 1 cat was mostly reinfected by their partner cat at home, and for the other 2 cats, it's still questionable whether this virus occurred from a compartment that was not reached by the drug in the beginning, or where the reinfection could have happened. In this study, they also looked at the partner cats, and they were all clinically healthy, but 2/3 of them were shedding feline coronavirus in their feces. And looking at the virus sequences from these cats, from the FIP cats and the partner cats, they were phylogenetically clustering together. So in this setting, here we have probably the internal mutation theory that is in favor over the pathogenic biotype theory. We also looked at S gene mutations in these cats that are described to be associated with systemic spread of feline coronavirus. We only found these mutations in cats with FIP and only in effusion or blood. And we also found a not yet described S gene mutation that has been associated with FIP. Then the next study, so this is really fresh out of the press. This publication is in preparation. Again, from the coronavirus in cats and kids group, and there 40 cats with effusive FIP were studied with the aim to look at the treatment duration. They used a licensed product from Bova, the GS from Bova. They had 20 cats in the 84 days group and 20 in the 42 days group. they used the WOMA medication at 15 milligram per kilogram once a day, oral. And that's quite a higher dosage than I mentioned in the first study. And the reason for that is that this XREFCon from Nutrition Life Science was analyzed afterwards, and they found that the tablets contained almost double the amount than what the manufacturer indicated. So to have more or less a comparable setting, the dosage was increased to 15 milligram per kilogram. In this study, almost all cats went into complete remission for at least 250 days, and 17 cats were already over 1 year in the follow-up, and they were still fine. 2 cats had to be euthanized, one at day 3, one at day 31, and the coronavirus was not detectable anymore in the cat that died on day 31. The other one, we are still figuring this out for the publication. There were no clinically relevant significant difference between 84 days and 42 days of treatment. And now I would like to hand over to my colleague Solene. She will present you about the study that we are doing at the moment in Zurich.
Thank you. Thank you very much. So based on that background, we set up this long-term prospective study on the effect and potential adverse effect of oral therapy with GS, I will call it GS right now, in cats with FIP. And as we already mentioned, this is a prospective base-center therapy study that we are running together with our colleagues in Munich. I will present you the design and some of the preliminary results that we have. And what I would like to mention at that point, we had the authorization from the Veterinary Medical Authority in Zurich to import this GS from Bova, UK, making it the first legal possible treatment in Switzerland under veterinary oversight. And as we heard just before, this is an important part as well to increase the chances that a cat recover from FIP under treatment. We have multiple aims. So the first one is to treat cat with FIP with oral GS. And by doing this, we want to confirm the efficacy once again in a large population of cats. And we want to look at possible long-term side effect and also find some prognostic factors from the clinical point of view, from the laboratory point of view, including the acute phase proteins, to help practitioners in the future in the discussion with the owner before starting the treatment. We want to characterize the feline coronavirus molecularly as well, and what we think is important in the response to treatment and in the general prognosis is to look at co-infections and other diseases in these very young cats, often coming from cat just big groups of cats. There is a high prevalence of co-infections that we want to look at the same time. It is a base-center study with the small animal medical clinic in Munich, Germany. We will include 770 cats, 370 in Zurich and 400 in Munich, that are presented by patients to the clinic. Our inclusion criteria are quite broad because we want to encompass the whole FIP cat population. So we take every cat with a confirmed FIP diagnosis according to the ABCD guidelines, so the European guidelines I will show you in the next slide. Excluded are only the cats that were already pre-treated with some antiviral agents effective against the coronavirus. We have no limits on age, weight, distance to the hospital, retroviral infections, co-infections, other diseases. And vet are able to refer patients already when they have the suspicion to allow us making a quick diagnosis at the hospital and start as soon as possible with the treatment in case of confirmation, because we see from the clinical experience that it is a very important factor in response to the treatment. So a short overview over the diagnostic approach. So basically, cats go through the process, and by going through this multiple-step process, they have plus or minus points, depending on characteristics that are plus or minus compatible with FIP. And if a cat gets a lot of points, then it's logical to go to further diagnostic in direction of FIP. If the cat only gets minus points, maybe you should go to your differentials again and look for a like diagnosis. Generally speaking, for FIP diagnosis, we don't have third test and that gives us the answer, which means that we combine basic data with pathogen detections. We don't rely on antibody measurement to make the diagnosis, but we will look at it in the study. And here, just one beautiful slide about the antigen detection, and then I will give you that, Andrea.
Yeah, so very quickly, we haven't talked about a lot of diagnosis of feline coronavirus, and immunohistochemistry is the gold standard to detect it. Post-mortem, essential for a definite FIP diagnosis, or intravitam. You could either do it on histology if you have tissue available, or also on cytology samples. That's what we do in the study as well. So we do cytospin of the effusion samples of the cats, and what we also do is we prepare a cell pellet from the effusion, remove the supernatant, fill it up with formalin, and then hand it over to Anja, to the diagnostic service in pathology. And we are very lucky that we have all these equipment and laboratories on site within walking distance on the campus. And yeah, so we are very happy to have this. Just a very short mention about PCR, as we haven't talked a lot about diagnostics so far. There are commercial laboratories that they tell you they have a FIP-specific PCR. However, this is unfortunately not true. In this study, they only took cats without FIP, and they looked at these PCRs that are available. And unfortunately, to make the message short, this mutation PCR is just not working. So they also detected mutated feline coronavirus in samples of cats that were definitely diagnosed not with FIP. This was confirmed with Sanger sequencing.
And as you can see on the left side of the slide, in cats with effusion, we rely on cytology and RT-PCR from the effusion. Cats that do not have effusion needs a little bit more of imaging diagnostic most of the time to get this big lymph node detected, for example, and TAP for cytology. In the cats with isolated neurological manifestation, we are lucky to be able to send them to MRI and have the CSF TAP most of the time. We have very compliant owners that have some money and want to invest some money in that cats most of the time. The most difficult one for the diagnosis for us are the one with isolated ophthalmologic manifestation that need maybe an humor aqueous, and that's difficult to do. Now to the design. You have here the overview. So cats are presented on day 1. They get through the whole diagnostic, and if they enter the study, they will receive 15 mg per kg once daily for 6 weeks of this GS from Bova, UK. And they are staying stationary at the hospital the first 3 days to make sure we are able to peel them, and to make sure they are not developing any immediate adverse effects, which was not the case till now. And then they are released home, and they come to regularly plan control visits over 2 years to be able to see long-term side effect, to see if they have any recurrence after stopping the treatment. So first control visit at day 7, already quite early, then at the end of the treatment, 6 weeks after, and then we see them at 6, 12, and 24 months after beginning the treatment, and most of the time we don't recognize them anymore. So here, sehr gut.
Now it's frozen, huh?
It's frozen.
Okay.
Sehr gut. There.
Yeah.
Yes. Good. So here you see the overview of the diagnostic process for the first presentation, but for the controls as well. And as you can see on the bottom, we asked the owner to do a little bit of homework during the treatment. We want them to write us any thing they would see at home during the treatment and after it, to be sure to be able to detect some side effects, which means a lot of work, but it's really interesting to see how they are doing. Exactly. And as we already said, this full diagnosis helps us to make sure that we have cat with FIP, but also to detect co-infections, concomitant diseases, and possible adverse effects. To go to the results, to the primary results, I think it's quite interesting. The most we included 112 cats during the first year of treatment and had a survival rate of 92% at the moment. I have to say that 12 cats are still under treatment, so we will see how they develop, but they are doing fine. Most of them are young cats with a median age of 1.4 years, but interestingly, 1/4 of our cats were over 5 years old at the time of diagnosis. And for us clinicians, this is kind of eye-opener because everybody will think about FIP in a 5-month-old cat presented with fever, icterus, and the swollen abdomen, but it takes a bit more effort to think about it in a 10-year-old cats coming with fever, and what we don't look for, we don't find, and we don't treat. So we think it's interesting from the signalement point of view. And as you can see here, most of them had an effusive form, but some of them had ocular or neurological manifestations as well. And if you add everything, you come over 112, because some of the cats with ocular or neurological manifestation had effusion as well. That helped us for the diagnostic. It's very nice to see how quick they improve during the first days or weeks of treatment. The quality of life have nothing to do with the beginning, already at the control after 7 days. The amount of effusion reduces most of the time to an amount that is not tapeable anymore, as you can see in the picture. If we are able to tap again, the viral loads are really decreasing very fast to a negative level within a few days to weeks. The acute phase protein are way better. All blood parameters normalize within 1 or 2 weeks in most of the cats. And at the moment, we didn't see any adverse effects requiring stopping the treatment from an ethical point of view. And as we will see later, we had a cat with recurrency after the treatment. Together with antiviral treatment and very intensive supportive treatment, it often needed, and I guess this is one of the reasons why we are successful in the treatment, that we are able to offer this in collaboration with colleagues from the ICU, and you see here one of our cats with neurological manifestation that had to be intubated and ventilated over 2 days because he had such a intracranial hypertension that he was not able to breathe on his own, and he is still in the hospital, but is able to stand and walk at the moment after having a few very critical days. So just not the GS would not have do that. We need a full treatment as well. With some of the cats, we were not that lucky, and these are the ones we would like to present a little bit more in detail now.
Yeah. So we had 9 cats in total that had to be euthanized or deceased, and 5 cats, they died within the first 3 days, and 1 on day 8. I think it's probably interesting to have a look at the data from the pathology. So I quickly go to this case regarding the time. So this was cat Amalfi. He died on day 2 of treatment, so had 2 dosages of GS. Here we see dominant priogranulomatous lesions, but also necrotic hepatitis in the liver, but there was also splenitis and lymphadenitis, and there was only minimal viral antigen expression and partly in the cell-free in the necrotic area. So where this necrosis comes from, we don't know yet. Is it due to treatment? At the moment, we don't know. However, probably we will have some more cases to fill up this. I mean, I do not hope that we have them for the cats, but to do studies, to get data, it's probably the case. And then we have cat Artemis. He died on day 5. And there, the postmortem examination showed a serofibrinous peritonitis, so with a huge, thick layer of fibrin that you see in the picture on the right on top, and then below plasma cells infiltrations. But there was no viral antigen expression detected, but there were also no macrophages anymore there. Where they are gone, what happened to them, we don't know yet. And the cat additionally also had a quite acute pneumonia, where the cause so far is still not known. So, as I said, elimination of infected macrophages within a few days. Where they have gone, we don't know. And these slides are double, so I think in the preparation something went wrong. Yeah, but no worries. So the take-home message for these cases is we should start the therapy as soon as possible. This is particularly important, as also Crystal mentioned in the talk before. When they are really sick, the chances are getting lower. And then we had one cat euthanized on day 24. I think this one we just jumped due to time reason. And then we have cat Neo, so he died on day 227. This is 180 days after end of treatment. And he had to be euthanized due to a septic abdomen, but he also had recurrent FIP. He had antigen expression in almost all the organ, so a fulminant acute FIP was diagnosed also in histopathology. There was this abscess in the intestinal wall. He had ulcerative colitis, so a fulminant FIP relapse. So there we go. So this is the next interesting slide looking at the euthanized cats. We had a look at the age versus treatment success. And there was a significant difference between the age of the cats that died, so they were mostly older than the other ones that were successfully treated. What are the underlying reasons? They could have had more concomitant disease. There could be a difference in the immune system, or FIP could have been recognized later, or we have less motivated owners to keep on with the treatment. Just some preliminary results from the study from the cats that are alive about reduction in viral load, remission of effusion. I think it's quite massive how fast these cats get better if you look at the viral load and also the number of cats that still had procurable ascites or thoracic effusion. The same we see in blood for these cats that have been positive in blood for feline coronavirus. By day 7, the median was already negative. Most of the cats were negative, and this continues over the course of the study. The same we see with acute phase protein, serum amyloid A. There is a very quick normalization towards the reference range that is indicated in green below. However, also here we do see that not all cats have elevated acute phase proteins. The same, if you look at the total protein, it normalizes very fast within the reference range. And by the end of the treatment, almost all are within reference range. And for those who we have the follow-up for already 1 year, they are pretty close. The same we see for albumin and globulins. And also the same we see if we look at bilirubin. So there is a normalization in hyperbilirubinemia. What we also looked at in these cats were co-infections on day 1 to characterize our study population. We found 4 cats that were FIV positive, 3 cats that were FELV positive. So these are 2 retroviruses of cats. So for those who are not familiar with cats in the audience. And we also found 27 cats out of 100 that were positive for feline calicivirus. And some of them, they had signs compatible with a feline calicivirus infection, but a lot of them, they didn't show signs where the clinician would say, I would like to look at if this cat has feline calicivirus, which I think is quite an interesting finding here. And what we also looked at is if the disease severity of these cats that had either FIV or FCV, if there is a difference. There is no difference. We looked at it with the so-called Karnofsky score, which is a score that goes together from the judgment of the owner and the judgment of the clinician. Yeah, we saw no adverse or side effects that were mainly relevant, maybe some diarrhea, maybe some elevated liver enzymes in some cats, and one case with atypical crystalluria where we don't know from where it exactly come from, if it could have been GS. However, we really recommend to screen for urolithiasis in cats that become acetemic or develop lower urinary tract symptoms. As Crystal also mentioned, I think this is quite important to have these cats very well monitored also for these parameters. Yes, so our special thanks goes to the Institute of Veterinary Pathology, Anja, for providing us these very nice slides and results from our necropsy cats. then also to our funders, so partly funding of the study, and to the audience, thank you very much for your attention.
That was wonderful, thank you very much. We have time for questions.
Thanks a lot, that was really amazing. At the end, you briefly mentioned the calicivirus infections. Did you check whether infection disappears with treatment?
Yeah, so we are looking at this. However, we have to say that we have only samples from standardized time points. So we have day 1, day 7, day 42. And I probably guess that calicivirus will disappear within this period. So we don't know exactly when it will disappear. But I think it's a very interesting point to look at, maybe also in vitro, to see if this nucleoside analog is also effective against feline calicivirus. For most cats, it's probably not clinically relevant to treat for feline calicivirus. However, if it comes to virulent systemic disease outbreaks, where a lot of cats can die from feline calicivirus, maybe this would be quite a nice option to have in the background, yeah.
That was part of my question as well, especially for the chronic cases. I think it's very interesting. Yeah. So I would start with the day 7 and just see what happens. But my actual question was whether your standard protocol is now reduced to 42 days, which is very relevant and very impactful. So thank you.
Yeah. So from the data we got from Munich, they really compared these two treatment durations, and at the moment we can say that with 42 days we have the same effect as with 84 days. We don't know where the journey is going, if we can further reduce even more. We don't know yet. I think further studies are needed in this direction to maybe also reduce the cost. The cost first, and yes, and also the impact on the cats, yeah, maybe the compliance as well.
Yeah.
I was wondering, in cases of relapses, whether you would treat again and whether you would use the same regimen, dose, duration, drugs, or would you try something else, for example?
Yes, at the moment what we are authorized to do is to treat again with GS. So in the cat that was quickly presented, the cat went to laparostomy because we were worried about abscessing lymph nodes, and it died from septic peritonitis before we got the results of the immunohistochemistry. So we had to euthanize him because he was really doing bad. But otherwise, we would have started again with the same treatment drug. We are looking into the possibility to adapt a little bit and extend our authorization to have maybe remdesivir as injectable drug for the cat that relapses, but we still have to go through this ethical approving process.
Yeah.
Thanks, that was awesome. You guys are treating a ton of cats, so that's so fantastic. You're able to do that. For your FELV positive cats, did you treat them with the same dose? Is it the same dosing protocol? Okay, yeah.
And at the moment, we had to skip the slide from the presentation because of time, but at the moment we don't see any reduced response to the treatment in these cats with FELV. We don't have a lot, but they seems to just be doing fine.
Yeah, that was my instinct, is that they would be fine. But FIP Warriors is treating them with massive doses, which I don't know if that's necessary, so that's helpful.
Yeah. We also looked at P27 ELISAs in this cat, and RNA and DNA PCR, and there's just nothing happening, also not on the FELV side.
Good, thanks.
That was amazing. Really excellent work. Really exciting, because I think this data set is going to keep on giving over time. I was wondering whether you're doing anything looking at the households from which these cats come, because it strikes me that you've got like an inbuilt control group of environmental exposure that haven't got the disease, and then you've got this amazingly well phenotyped collection. Do you have a sense of, it seems like quite a wide geographical distribution that you're getting as well, so are you collecting data and samples from housemates or cattery mates? And how is that looking?
We are collecting. We don't have any analysis yet. I mean, what I know from doing the anamnesis, I mean, I think most of the cats that we have are going outside at the time they are diagnosed. It is quite often in Switzerland for a cat to go at least in the garden. And most of the time they have a soulmate at home.
Are you getting samples of anything from those cats?
So we want to set up this. We have now the ethical approval to do this, because in Switzerland you need also ethical approval for this.
The UK. Yes.
And we also extended our anamnesis form, that we ask not only for are there any other cats, but also are there any other animals. So also dogs or whatever, we want to know who is living in this household, and we want to look also at partner cats especially.
Yeah, because I think this has the hallmark of a data set that's going to, so this is going to be the foundation cohort, and you're going to go on and grow this and actually never stop. but that will become extremely powerful, because you'll be able to then see trends in time as well. But it's really exciting. Thank you.
Thank you very much. That was really good. Can we give another clap, please?
Thank you.